So hi, my name's Valee. I'm going to show you what you can do with an injury. How long have you had the injury for?
10 months.
She's had it for 10 months and you had an ACL rupture, and it's been a really hard and long journey, isn't it? So I'm going to show Leanne how to use the massage balls to help release the tight tissues that are around the knee joint and also the lower leg and the upper leg, because what's happening, you're very, very stiff. You can see that the knee is higher, the left knee is higher than the right, and there's saying it's heavy and stiff and still quite painful, and you've got areas of pain and obviously the areas of tightness, but also on top of that, because it's tight and the connective tissues are tight, the leg won't be draining very well, so that would contribute to it feeling heavy and less flexibility. So use different size balls. So this is just a ball that I bought in a local shop, and you can use tennis balls, you can use other types of balls, the big spiky balls you can use as well. So I've just done a bit of palpation around the inner knee. There's actually an attachment here and it's quite sore, so Leanne can actually use the ball to find the area of tension or pain or discomfort rather, and she can just press into it and hold it for up to maximum 2 minutes, no more than that, because otherwise you're going to stretch the connective tissue too much, and that will start to help to release that area of her knee. And also you're tight in the calf, aren't you, and through the back of the knee. So what I want you to do is actually sit up, if that's all right, and you're going to bend your right leg, and we're going to lift this leg up, and you're going to roll. So you move your body and you just roll the ball around until you find an area of discomfort. So then you just hold that for say a minute.
Put weight on it?
Yeah, you can put your weight on it, so you can adjust your weight. So if it's too sore when you first find that place of discomfort, you can take the weight off. So you can adjust your weight to find that balance. So you never ever create any pain. It's really important that you don't create any pain. And then that's right, and you hold it for a minute, and then you can move it to the next place that's uncomfortable. So if you were to give the discomfort a number out of 10 right now, what would it be?
7.
Yeah, so you don't want to go any higher than a 7. It should feel really nice pain.
Yeah, that's it.
Yeah. And what you're looking for, it's really good if you can, is to get connected to the area of tissue and listen for it to start to soften. So once it starts to soften, you know you can move on.
Right.
And usually that will be within around a minute's time. Otherwise you really need to just watch the clock and make sure you don't do it for too long. So I would suggest that you cover the whole of your calf. You never ever put a ball behind the back of the knee. Okay, you never ever push into there, because there's lots of vessels through there and you can create damage to the joint, so you never want to do that. Okay. These two balls are obviously bigger, and so they can cover more area, and it might be easier, and it will just lift the leg up a little bit. So you can try one of these balls in a minute.
Yeah, it feels good.
Yeah. What I would do is say do it every other day, and
so this should help with the contraction.
Yeah. So Leanne can use the balls underneath. When she's finished that, she can use this ball. So maybe we'll take that one out and just roll this one around and find those areas in your hamstrings, or an area in your hamstrings that's sore. And tight, yeah, and so you find that it would be better than this one because it's bigger.
Yeah.
Yeah. So what else you can do is, whilst you're doing that, I'm just going to palpate and see where you're tight. So I'll give you an idea. So I'm just going to palpate up. You just tell me. Any discomfort?
It's tender.
It's tender all the way through.
Yeah.
Okay, and you're probably tender up through here.
Yeah.
Yeah. So what Leanne can do is she can use, say if you've got a tennis ball, you can use on the side of the leg all the way up against the wall. So again, but you'd have to use your hand to move it. So you can start up here actually and find the place that it's sore,
Okay.
and use your weight to push into it against the wall,
Yeah.
and then keep moving it down and finding those places to help release the outside fascia. And then the same with the thigh muscles. You can do the same thing up against the wall as well. Okay, and just roll it around to find where it's sore, and then use the wall to push into it. You could even do it a little bit by hand, rolling it around.
Yeah.
So it's uncomfortable anywhere. I'm not pushing in hard. It's quite superficial. So you can look for the areas of discomfort, and you can look for the areas of tightness. So, for instance, maybe in there.
Yeah.
Although you've got the other ball, you can push in with your hand if you want to. But it's actually better to use the wall because you can really get a lot of pressure.
Yeah.
Yeah.
And you also can really feel. Yeah. It's it definitely feels beneficial. It feels like it's releasing quite a bit.
Yeah, yeah. So you will feel the tissues. You put your awareness into the area, you'll feel the tissues start to release, and that's when to move on. And I'm sure if you did this regularly, or even doing one session, you'll feel some form of release. So it's really, you can palpate all the way around the joint, and particularly wherever there's any attachment. You won't see it on the film, but we've got attachments of the adductors. That's an attachment.
Yeah.
Yeah, that will be. Most people are sore there. Unfortunately, it's really hard to work through the inner thigh, unless you're going to use your hand, obviously, to compress it. And so in those areas, you really need to have a therapist that can work a lot deeper for you. But these are the sort of things we're going to be doing in my pain relief clinics in a group. And I know working with clients for a very long time, these are one of the most amazing things that you can do, is using massage balls to help yourself to release the tightness and soreness in your body, and to give yourself more freedom, and to be able to do that at home. And it really helps me as a therapist, because some areas, for instance, working through the IT band, it will take me a long time to release the whole IT band, but you can actually start working at it at home, and I can go and work with other areas that you can't actually do yourself. So there's a huge benefit from coming along to the clinics and learning these, how to use the massage balls, and also some really good stretches that you can use on a daily basis.